All right, this has been an absolutely fascinating discussion over the past day and a half. I have learned many things, but mostly about how we're all struggling on one level or another with very similar challenges. As Jim said, my remit is providing oversight and guidance to our internal medicine and occupational health department. It is true, I was listening to you say it, it sounded so broad, it was almost scary. 90 clinics across 30 countries. And basically, we need to be able to provide health support wherever ExxonMobil is operating in the world at that time. So that could be someone calling us from a platform in the North Sea. It could be some seismic vessel offshore Vietnam. It could be up in the Arctic. It could literally be anywhere. We keep huge maps on our walls that indicate, our stable operating locations. So wherever they are, we have to have a health plan to figure it out. The other graphic that we have here sort of shows how we segment our work. So we're not just one medicine and occupational health department. We actually split ourselves into 6 different segments. Obviously, we have clinical services, which is a big part of what we do, and depending on where the operations are, that will take on a different flavor. It could be primary care, and everything else that we have to do to support someone in locations where the healthcare delivery system can't provide for our needs, or if it happens to be in an urban center where we have an office, et cetera, we're going to defer the primary care to the surrounding community and focus more on occupational health services. We also have industrial hygiene, and they are the folks that tell us what the ambient conditions are in our operations, because occupational health and safety and keeping people safe from exposures, chemical exposures, radiation, et cetera, is extremely important. We have substance abuse and testing unit. We have what we call culture of health. I know a lot of people during this session already were talking about well-being. That's also very important to us, and it should be if we're sending people to far-flung areas of the world. We want to make sure that we take a holistic view of well-being. Infectious disease and control unit, that's what we like to call our internal public health unit. They're very, very busy because of the locations where we operate. Typically, if there's an outbreak going on anywhere in the world in some way, shape, or form, it's probably impacting one or more of our operations. So this is something that we continuously receive updates on. And we're very vigilant. The last one that's up at the top is our technical operations and support. As I listened today, many people emphasize how important the management aspects of healthcare delivery are. And that's where the magic happens. That's our administrative, fiscal people, the logistical support that we need to pull this off across all of these countries. This is a team of folks who come along beside us and help us figure out the how are we going to get this done. So I tell you, it's very gratifying work. Usually in these locations, we hire our clinicians locally from those areas, so they are very, very familiar with the healthcare delivery systems in those locations and all of the challenges. We're centrally managed, so we don't just leave them out there. We want to make sure they have maximum support from all of the departments that are around that figure there. But we can also provide them toolkits, standardized procedures, et cetera, so at least they're not starting from nothing. So where we can use local resources, as I said before, we will, always being careful not to overwhelm the local healthcare delivery system. I'm not going to flip back to the first chart, but, oh, sure. Wow. But you know, this is actually a challenge in communication. As you said, each of these companies, I think people tend to think of a company as kind of one homogeneous entity to deal with. That is not the case, not within ExxonMobil. You are dealing with different companies, all with their own mission, all with their own process of operations. They're all operating in different areas, different hazards, and different healthcare needs. So this is the trick of it. You have to be an extremely good communicator. As you said, these are our customers. We are a service unit, and it is our job to form these internal partnerships. So before we can even think about external partnerships, we have to think about our internal partners, who they are, what are they doing, where are they doing it, what do they want, and what do they need. So this is a series of ongoing discussions and adjustments, et cetera. It's also a very dynamic operating environment. I think also people feel when we go into a place, we're there, you know, we're all set. There are different phases of a lot of these operations. And in, you know, if we're building something, we might, for the first 2, 3, 5 years, be bringing in thousands of individuals. Not only, you know, ExxonMobil folks, but contractors that are coming in. We can have 10 to 15,000 people descend on one location at one time to start construction. Think about what that would do to a healthcare delivery system in a small country. So these are things that we have to think about up front, so that we first do no harm and provide the folks that are going to be there maximum support. So with that said, I will end it and pass the mic on.